And next, I want to introduce Savannah Lavenstein. Many of you probably know her. She has been with Image Reborn since 2017, 18. She's led the adventure retreats. She's currently helping me with the virtual retreats, and she is by trade a nutrition counselor. Nutritionist and counselor. Her platform is Food and Feelings, and she's going to speak to us tonight a little bit about trauma, being trauma-informed, boundaries, self-care, and I trust that she has some amazing topics for us. I kind of leave it free-flowing for her to pick and choose what she thinks is most advantageous for us. So please welcome Savannah.
Okay, thank you guys for your patience. As Ali said, my name is Savannah Lavenstein. I am one of the in-house nutrition people for Image Reborn, and I have been for 8 years, which is pretty wild to think about. So much has changed in the years that I've been with Image Reborn, and as a nutritionist who came to Image Reborn, but not as a person who's experienced breast cancer, I'm really passionate mostly about just creating the container, a safe container for my attendees to be able to connect with one another. So my chat with you all today is basically about removing barriers to creating that safety of a container. And some of that is about language. So some of that's going to be about language, and some of it is going to be about boundaries, so that you have the structure where within that structure things can kind of flow safely. And I've noticed that if I can hit these points, I can basically guarantee that there will be more safety for my attendees. And I'm not saying gals, because we'll talk about that in a little bit. For these humans who are attending these retreats, that they're able to connect and find safety quicker and find connection, regardless of where they might have come from. And even regardless of backgrounds and shared communication styles. So the first barrier to connection that I've noticed is just noticing the language that I use about myself. So I've noticed I can create more safety more quickly if I'm very cognizant of the language I use when I speak about my own body, my own food, and removing or releasing judgmental language that might have to do with size or appearance or amount on my plate. If I can release those things, it can help me drop into a deeper level of connection pretty quickly with my attendees. And what I think is interesting to notice is just how often are we just talking about how we look or how big something is, or how much is on the plate, or how little is on the plate, or how much should be on the plate, and how much we kind of hide in those amounts instead of what we're actually talking about. So if I can acknowledge and release those judgments within my language about myself, I can support my community into dropping in a little bit deeper, a little bit quicker. So that's something I'd just like to invite you all to pay attention to within the next couple of days, maybe. Just noticing how often do I default to speaking about how I look, or how much is on a plate, or what somebody else looks like, or sizes. It's very interesting to just notice, catch it, and release it. And notice how we're able to connect on a deeper level if we can release those judgments quickly. Catch them and release them. And then my second barrier to connection is pretty closely related to like the judgments about size and shape. And it's actually just about plates. This is actually something that you should take potentially into your holiday season. And it's looking each other in the eyes instead of in the plates while we're dining together. And then also the up and down that people will do when you see relatives or friends after a little bit of time apart. Just looking each other in the eyes instead of in these other places where we're kind of unintentionally measuring each other. which also tells us we unintentionally measure ourselves. I'm trying not to hit the microphone as I'm like, how do I do this? I guess this is such like a habit for me. But to look one another in the eyes instead of in the plates. And yet again, we notice how often do I default to communicating about what's on my plate or what shape am I or what's right or wrong, but like, how am I actually feeling? What do I actually want to feel? And what do I need? That those are actually what we're at this retreat to talk about. So this will help me just jump into that level a little bit quicker. And then my third barrier to connection that I've noticed and recognized over these years is, am I letting somebody tell me who they are, or am I telling them who they are? And this could look as benign seeming as just telling someone, wow, you look so great, or you look so fit, or you're so driven, you've been up on a run every morning. I'm telling someone who they are instead of asking, how are you feeling? Talk to me about this movement every morning. Where does that come from? Is this something that you love? Is this something that you feel like you have to do? Like, talk to me about it. And getting really curious about my attendees, asking them to teach me who they are, each of them, instead of telling them, you look thin, you look driven, XYZ. And as we know, when we've been through therapies or treatments, sometimes when someone says, you look amazing, this is the best you've ever looked. And it's like, this is the most miserable I've ever felt in my life. I am heartbroken, I am in, surgeries, and I can't believe that you are telling me that this is the best I've ever looked because I lost, whatever amount of pounds. Like, how sad is that? And not only does that judgment hurt, but it makes me aware that I'm being judged every time this person has seen me, right? Instead of just being asked, how are you feeling? How are you doing? What is this about? Teach me who you are. So these three barriers to connection are just some things that I want to invite you to consider over the next couple of days. Noticing my own language. How often am I judging me with my own language out loud? Which could be teaching my attendees what I expect of my retreat, right? Or of my practice, because I also run a private practice. And the way that I speak about myself really sets the stage for how my patients might think I expect them to speak. So we're noticing our language about especially how we speak about ourselves. And then on a second one, we're noticing our plates. We're noticing, how often am I looking at a plate instead of a person? How often am I noticing amounts instead of a conversation? And this one, again, really useful at Thanksgiving and Christmas, to just look each other in the eyes instead of to do the up and down or checking someone's plate. Oh, girl, like you went back for seconds or fifths or whatever. Who cares? We're really there to connect, right? So bringing these kind of, like, I would call them toxic behaviors from, the girls' lunch table in high school, they kind of follow us into these later years, and unintentionally, they even follow us into our professions in these places and spaces that are supposed to be safe and nourishing and inviting. And then my third one of just letting people tell me and teach me who they are is that third invitation that I have for you all. And we really recently learned this at a retreat where I have to call myself out right now. I had missed inviting all my attendees at the beginning to let me know how to refer to them as. So like, what's your identity? And it just so happened to be during the Barbie movie. So everybody on this retreat was going, hey Barbie, hey Barbie, hey Barbie, because that was part of the movie. So this individual felt super left out because they were never invited to say, like, how do you identify? Oh, well, they did not identify as she, her. And this human is experiencing stage 4 breast cancer. So not only does this human not identify as a woman, but these boobs are trying to kill them, right? And how totally isolating would that experience be? Especially when a container holder missed an opportunity to say, tell me who you are. So that's kind of like a big example for me that's very memorable of let me let somebody tell me who they are and to really be curious because I had no clue that I missed that opportunity. And so I want us all to remember that maybe we don't know until the very end how useful that moment could have been of just allowing that person to teach me how to take better care of them. So that's a little bit of a self call out that's also going to be so useful for all of us who are providers and space holders and givers and healers and helpers and mothers and grandmothers and people who've experienced breast cancer, because that's now how I refer to this community, is people who've experienced breast cancer or who are experiencing breast cancer. Because I also learned that that human didn't want to be called a survivor because they did not perceive that that is the journey or the route for them. I learned so much on that retreat, and that human taught me so much about just giving someone that chance of how do you identify and what does cancer mean for you. So I think that in a female dominated disease world that we're in, it's very easy to slide into language like this is only women or survivors, which I believe wholeheartedly, if that's how somebody identifies, that's beautiful. And I also don't want to get lost in blanket terminology. I want to stay curious. And that's a huge passion of mine, is just how can we hold containers even better? And especially as someone who hasn't been part of this community, but who is so lucky to get to companion people in it. These are just some ideas that I've come across over my years, and I think it's useful both in my clinic and out in the adventure retreats and in the virtual retreats. And as we move through these next days of meeting new people and sitting at new tables and learning from each other, it might be cool to pay attention to these little points. And yeah, my chat is a little bit shorter, but I would like those points to be memorable, to see if we can take those homework assignments and maybe even find some nuggets through the next couple of days. And I know I didn't get to meet everybody today because I've been ping-ponging around, but hopefully tomorrow I'll get to meet everybody a little bit better. And I don't know if anyone has any questions for me, but that is what I have for you all.
If you could go back.
Yes.
And say, I missed this opportunity, how would you do it differently? And how would you allow that to arise organically? Or would you ask those questions?
I think an opening circle where we do have that question of how do you identify, how can I best address you? That's a question that I just missed that day. And we could get caught up, especially in this day and age of like, there's so many ways and rules that I need to follow, so I'm just not even going to try. So I think it is so important to find what are the simplest ways that I can do this and stay inclusive, inviting, warm, and really curious. And so for me, instead of making it a rule, like a list of rules, my rule is going to be, let you tell me who you are.
I have a sibling that recently I had a discussion with. They like to be identified as they, them, he, him, and born as a female.
Mm-hmm.
And I said, that's cool with me. I love that. Thank you for sharing with me. Please have grace while we're both learning here, because we're all learning here.
Yes.
And I surely do love you all the way to the heart.
Mm-hmm.
But there are going to be mistakes, and you can't beat yourself up.
Yes.
You didn't remember correctly. Hurt feelings are going to happen.
Mm-hmm.
There is like new and we want to be excited with it together.
Yes. And I love how you said that of like, thank you so much for teaching me how to love you better. And it's going to be a learning curve on all of our parts. And the courage, the amount of courage that it takes to share, like, hey, this is going to be hard for everybody. And I don't want to be, a burden. It's very brave when someone is like, hey, I need to ask for a different love. And so it's also a really cool and incredible opportunity to be like, and I can hold this for you. And it definitely still won't be perfect, just how it wasn't perfect before. But thanks for letting me try.
And it can feel really scary.
Absolutely.
That, like on both sides, like they were afraid to tell me.
Yes.
And I said, oh, I get it. Yes, makes sense. Our
Yes.
has stuff. I'm so here for you.
Yes.
And thanks for telling me.
Yes.
And then it took away that like shame from both sides.
Mm-hmm.
Like, I'm not afraid of any of that. And that was probably the best reaction. Let's just know there's a learning curve and you're good to correct me.
Yes, and remind me, yeah. And that's a great reminder right there of like, hey, we're all learning together. And if there is a failure or you need to be loved differently or cared for differently at any point in this, whether it's this retreat or this weekend or this summit or this dinner, like feel free to teach me how to take better care of you because that's what I'm here to do. That's my heart and I want to try, which also gives the other person or people space to say, and what I need is this. So it's so cool when someone uses their voice. And a lot of times we can kind of feel the voice. So like silence isn't that quiet, right? When somebody needs to say something, but they're not. Silence isn't very quiet when something needs to be said. So being that safe space to invite those words to come out really lightens a whole room, even when they're pretty heavy words. Yes, ma'am. I said, yes, ma'am.
Oh.
I should I should have said, how do you identify? And I would be being serious. Yes.
Okay, hopefully this is still on point.
Mm-hmm.
Going back to your very first thing about the way we talk about ourselves.
Mm-hmm.
What if you're around someone that's constantly putting themselves down and always pointing out, oh, look, I have someone in my life like that,
Mm-hmm.
and pointing out to children, oh, you're so skinny, or you're so old, I'm so fat. Like,
Mm-hmm.
that is tricky. And
Absolutely.
I have 20 years of like, I don't even know what to say right now, but it's like not okay.
Mm-hmm.
But like, how would you, hopefully this is helpful.
Yeah. And I hope this will be helpful to people because this is one of the first conversations I have with a client is like body autonomy. So basically I get to be in charge of my body. Nobody gets to comment on my body. Literally, nobody gets to comment on my body. And if I ask somebody about my body, it's usually a trap. If it's like, tell me about this, it's a trap, right? So the conversation that I usually ask and almost beg my clients to have with their families or with people who have a tendency to body talk, which I say body talk, is to say, hey, it doesn't feel safe for me when I feel like I'm being x-rayed around you, and I don't want to hear about my body or anyone else's body from you. So it's fine if you want to talk with other people about that, but when I'm there, it's not safe. I don't want to hear it, and like I need you to respect that.
I'm gonna piggyback on that. So I heard you say, so if I was, you used yourself, I don't want you to talk about it.
Yeah.
So if it is someone else, and I'll just say it because it's the easiest way to explain it.
Mm-hmm.
So my mother likes to tell me all the time about my daughter
Mm-hmm.
and her weight.
Mm-hmm.
And it has come to just horrendous fights. So other than just saying, you know what, I'm done with you, where do you go from there?
And
the daughter doesn't even know that this ever even took place.
Yeah, except for just like we said, like those words are heavy, and we definitely know when those conversations are happening. There's some sort of energy about it, right?
Oh, yeah.
Where we can feel that we're being examined by people, even if we're not in the room. So once again, that would be a place, especially before the holidays are coming, at least the holidays that like get a ton of, woo woo in my world. I want to really make sure that I make these boundaries before I encounter these people. And it has come to places in my life, like personally, where I have said no to certain like family gatherings because people don't have the ability to hold back. But calling my different relatives and saying, hey, I love you, and how to love me back is to please respect this ask from me, which is body talk is not okay with me. I don't want to hear about my body, and I don't want to hear about anyone else's body. It's fine if you choose to speak like that with other people, but when I'm there, it's not safe, and I can't be around that. So if you want me at the dinner, I need to ask that you respect that. Sometimes it has been respected and sometimes not, but this is a really cool way to transform an entire family. And slowly but surely, like over the past, I guess, 15 years, when did I drop out of med school? Ever since my family really took this seriously, that, like body fears, body dysmorphia, body eating disorders were like going to take my life, even though I was going to be so successful and so productive. Why don't people take it seriously until it's at that level? And then they still keep doing it. Well, you look better now, right? Maybe it has taken us close to 15 years, but that type of conversation does not happen at least at the table with me anymore, which is great. And I do believe that there is hope for transformation. And I think that I would like to see our next generations not have to deal with this on the forefront like we have had to, especially when bodies are going through transformations from these surgeries. Bodies are going to keep going through transformations as we go through hormone therapies, as we, have hair loss and hair comes back a different color, different texture. And it won't be like, Mommy, why does Aunt so-and-so look weird? I have a patient who just went through that, and she just left that house in tears. Like, why is a 5-year-old commenting on my body and my hair and my weight? And it's because that 5-year-old is being raised at a table where that's okay. So these little revolutions really start at the table and with those asks of like, hey, it's fine if you want to do this with other people, but it isn't okay with me. And like, you're not a very good x-ray machine. Like, go take that elsewhere. And thank you for these questions. I'm so passionate about that. And how cool is it to watch the conversation at a table really go deeper? Because we're not really talking about a plate or someone's pant sizes. We're really talking about how someone's really uncomfortable, or about how they're afraid of the next chapter of their lives, or what they might need, or that they might need a relationship shift. There are so many cooler things that we can talk about, and we don't get to do that if we keep allowing these kind of lazier conversations to be on the table, for lack of a better phrase.
I just wanted to share something that happened at a retreat in Colorado this last year. We have a yoga instructor, and she teaches Reiki. She's just the kindest person ever. After her yoga session, one of the participants came and talked to me, and she was almost shaking. And I was so taken back because everyone loves this class. It's just the best thing ever. And she said, I was really hurt by something she said. And I said, well, what was it? And she said, she called my name out and called me out in front of the class, and because I couldn't move the way she wanted to. And I said, oh, okay. I said, would you mind talking with us, her and me, and kind of explain how you felt, what we can do better? So our provider she was totally open to it. She accepted everything she said, and this participant was going through trauma-based therapy.
Mm-hmm.
So whenever her name was called out, it just triggered something, like she was doing something wrong. It just, that was her feeling, and it just, I never thought of it. I'm just there, everybody's great, we're having the best time ever. So it really took me back, and it made me aware of how you call people out, and especially the people we work with, if they're not moving the way that the yoga instructor is moving, there's something prohibiting them from
Right.
moving. There's always a backstory to this. So it was great how it came out. It was beautiful because they both talked, and all three of us were in a little circle talking about what they could have done and what could have happened.
Mm-hmm.
It was just a great experience, and I really never thought of it before. I do get triggered when some people call my name out when I'm training or other things, but it's just a quick trigger of like, you do something wrong, they call your name. So I was able to get over it, but there's not everyone can get through this.
Right.
Doing something unintentional.
And in addition, because I also talked to the participant,
Mm-hmm.
took a movement class with me also, and it was that she felt shame
Mm-hmm.
that she couldn't do things she used to be able to do.
Mm-hmm.
And shame has no place at any table. And so it's, yeah.
And how cool to do it in real time, right? To have the words actually show up where they belong instead of they show up later in a room where we couldn't have worked on it then. That is so incredible. And even just to have a little breakdown session after movement sessions or mealtime sessions or groups where it's like, let's, how did that go for everybody? And just offering space to put some words down and have that invitation of like, you are a co-creator here. You are you are the most important people in the room, the attendants or the attendees. Wow, great. Luckily I can say I had brain surgery, right? But those moments of the check-in, like how robbed would we be if you didn't get those moments of like, thank you so much for teaching me how to do better. Because it's not at all like we get a hit, we're like, oh, ouch, we're like, thank you, right? And so I think that thank you is also so hugely important, just like we were talking about with the they, them, he, him conversation of being like, thank you for giving me more information on how to take better care of you. And I'm so grateful for that moment that attendee was able to do that, because it's hard, and we don't know which version of someone we're speaking to in those moments. I'm just really grateful that happened with you all. I hope for more moments like that for our retreats, and I hope that we keep creating spaces where it's safe to do that. And like, don't even get me started on the food stuff. I really, really want to keep mealtime safe. I appreciate so much that Image Reborn helps us have really recognizable foods from all sorts of different homes. And I don't want to make any food right or wrong. And that's another invitation that I have on why I'm saying, like, let's look each other in the eyeballs instead of what we chose on our plates. And we can say like, what was your favorite part of this meal? Or how are you feeling after that meal? Or what were you missing, if anything, from that meal? But these places where we put labels on stuff and we basically start to strangle the connection when we start talking about bodies and sizes and shapes and plates and amounts. And basically, I've brought this little phrase, numbers have never helped me, basically ever. Unless it's a clock, like numbers have literally never taken good care of me, ever. So like whether it's, a weight or an amount or a pant size, they really don't help me unless they're on a clock. And I really should pay better attention to those ones. But yeah, thank you so much for listening to this like heart work that I do and that I love so much. I appreciate it.